The insertion of an intrauterine device, also known as an IUD, after childbirth is simple and easy to undertake if the correct procedure is followed carefully. This procedure can be done immediately after the placenta has been delivered and is described as postplacental IUD insertion, or simply as PPIUD insertion. The advantage of IUD insertion at this time is that it is an occasion when the healthcare professional is already attending to the woman, and since the IUD insertion takes only a minute or two, it is a convenient opportunity and saves time for both of them, whilst also avoiding the need to arrange a second, later visit to the clinic. Remember that active management of the third stage of labor should be carried out as normal before insertion. PPIUD insertion can also be undertaken up to 48 hours after delivery. However, after 48 hours has passed, postpartum IUD insertion should be avoided for 4 weeks or longer postpartum. You should check that the woman has been counseled and given consent for a PPIUD insertion. Ensure that there are no delivery-related contraindications to PPIUD insertion. These contraindications include any rupture of membranes lasting for more than 18 hours, any signs of chorioamnionitis, any signs of ongoing PPH. Set out the sterile instruments required for PPIUD insertion: long placental forceps and sponge-holding forceps, often called sponge holders. Sometimes ring forceps are used instead of sponge holders. You should also have the IUD and a good light source available. Wash your hands and put on clean gloves. Inspect the perineum, labia, and vaginal walls for lacerations. If these are not bleeding heavily, repair them after IUD insertion. Gently insert the seam speculum into the posterior vagina and depress in order to visualize the cervix. Clean the cervix and vagina with antiseptic. Gently grasp the anterior cervix with the sponge holders, close to the first tooth only, and let go of the handles. Open the bottom of the IUD packet and firstly remove the long plastic applicator and inserter from the packet, leaving only the IUD inside. Then, using the long placental forceps, grasp the right hand arm and stem of the IUD and remove it from the packet. Apply gentle traction on the anterior lip of the cervix using sponge holders in your left hand to lift the anterior lip up. Using the long placental forceps in your right hand, pass the IUD into the lower uterine segment, taking care, where possible, not to touch the vaginal walls with the IUD. Keep placental forceps closed so as not to drop the IUD into the lower part of the uterus. Once the IUD has passed through the cervix, remove the sponge holders from the anterior lip of the cervix. Move your left hand to the midline of the abdomen, feeling the uterine fundus through a clean abdominal towel placed on the anterior abdominal wall. Ensure that the base of your hand is over the lower uterine segment. There is a sharp angle between the axes, for direction, of the vagina and the uterine cavity. The uterus needs to be elevated in the abdomen and pushed upwards to straighten out this angle. If this is not done, you may think that you feel the IUD is against the fundus, but actually it is only against the back wall of the lower uterine segment. It is very important to place the IUD against the fundus in order to minimize the chances of expulsion. While maintaining pressure in order to elevate the uterus upwards in the abdomen, move the long placental forceps towards the umbilicus until it reaches the uterine fundus, when you will feel a slight resistance. This resistance can also be felt by the top of your left hand, which is placed over the abdomen and positioned at the top of the uterine fundus. When the placental forceps is at the uterine fundus, its handles will be close to, or at, the patient's perineum. Remember to keep the placental forceps closed so as not to drop the IUD in the mid part of the uterus. Open the long placental forceps and move them towards the right-hand side wall of the uterine fundus. Slowly remove the placental forceps, keeping them open so as to avoid them catching the threads of the IUD and inadvertently pulling it out of position. At the same time, keep stabilizing the angle of the uterus with your left hand through the abdominal wall until the placental forceps have been completely removed. Check the cervix to make sure there's no bleeding and that the IUD cannot be seen near the cervix. Remove all the instruments and place in 0.5% chlorine solution so that they are completely submerged. Dispose of waste appropriately. Remove gloves and wash hands. Tell the woman that you have finished fitting the IUD. Continue with routine postnatal care, including immediate breastfeeding. Ensure that the woman is given post-discharge IUD instructions and record the IUD insertion in the labor ward register and in training logbooks. Summary. Good technique helps to reduce the chances of spontaneous expulsion. Important steps include grasping the IUD on the right-hand edge while still in the sterile packet, elevating the uterus in the abdomen in order to straighten out the angle, ensuring placement of the IUD high in the uterus at the uterine fundus, keeping the Kelly's forceps open while withdrawing, checking that the IUD and its strings are not seen coming through the cervix.